Hi everyone. In today's video, we're going to be talking about a much contested debate in the psychiatric community about the importance or the role that medications can play. And so we are going to be addressing the question of whether or not we are pro-med. Hi, and welcome back to the Living Well with Schizophrenia channel. If you're new here, my name is Lauren, and I make videos about what it's like to live with schizoaffective disorder or schizophrenia. And if you would like to see more videos from us, make sure to subscribe to our channel. And also, if you would like to help support the creation of future videos like this one, please make sure to check out our Patreon page. The link is in the description below. So something that me and Rob, my partner Rob, are often accused of is that we are actors for Big Pharma. And, we're just playing a trick on our audience, and we really have this, big med pushing agenda. Or, some people also accuse us of secretly being psychologists or psychiatrists, pretending that we're living with the illness or that I'm living with the illness, but that is also not true. I promise you, I am diagnosed with schizoaffective disorder, and Rob is my partner. He has no degree in psychology or psychiatry. I am a social worker by trade. I'm not currently working as a social worker, but I have. But essentially, I am on this channel talking about my lived experience with schizoaffective disorder. Okay. So, oops. Rob just stopped me there and reminded me that he does actually have a degree in psychology. He's not a psychologist or a psychiatrist, but he did major in psychology in university. Anyway, what we're hoping to do with this video is to really give a more nuanced conversation or discussion about, the necessity of medication and whether or not we are, pro the use of medication or against use of medication or somewhere in between. Okay, so first I want to dive into some of the reasons why we are pro medication. So, it is a very useful tool in terms of managing symptoms and avoiding relapses. It definitely has helped to manage my own symptoms, and every time I've gone off medications, I've relapsed into a fairly large psychotic episode. And so, it has helped me to remain relatively stable. It also helps improve overall functioning in life. It allows me there to be less emphasis on the distressing symptoms that I experience and to kind of soften that, and allows me to engage more in life. That said, there are side effects, which we'll talk about more in the cons section, but generally speaking, it allows me to engage in life in the way that I want to. And something that we often say on this channel is that we really see medications as kind of a foundational component to care. So once you add medications and get stable on that, it is kind of laying the groundwork to be able to add more psychosocial interventions that will help further, help someone manage an illness like schizophrenia and further enrich their lives. Okay, so diving into some of the cons now about medications. So there is always the risk of dependency. So, I often wonder, if I hadn't started taking psychiatric medications when I was 19, would I have needed them so badly for the last 10 years or so? And so, that's kind of an unanswerable question, because there's no way of really gauging that. And there's no way of gauging how much the role dependency has played in terms of my need for medications. What I do know is that when I stop taking psychiatric medication, my symptoms come back really strongly, and it's very hard to live my life off medication. And so it's kind of hard to differentiate whether or not this is an issue of dependency on medication or whether or not it's just an issue of medication being a foundational component of managing my symptoms. There's also the issue of cost and access to these kinds of psychiatric medications. In a lot of countries, it's not covered for people who need these medications. It's not covered. There's not, they're not easily accessible to people. And so that is definitely a huge con to medication. Where I live, Canada, it is covered. Most medications are covered by the government, which is nice. And generally speaking, it's fairly easy to access it. You just have to be in contact with a doctor or a psychiatrist who can prescribe it, and it's fairly accessible at most pharmacies. But that can be an issue in other places in the world. And actually, to add to that, I realized that the reason why my medication is covered in Canada is because I am on a provincial program called AISH, or assured income for the severely handicapped. And this is a fairly hard program to get into. And so if you're not on this program and you don't have health insurance that covers drugs through work or any other way, you would have to pay out of pocket for your medication. So that is definitely a huge barrier for a lot of people in terms of accessing this medication. And then, like I mentioned before, the debilitating side effects of psychiatric medications are definitely a potential con to taking medications. A lot of medications that I've been on, it just hasn't been worth it in terms of the benefits it gives me of managing my symptoms being eclipsed by the negative side effects that took place. So either I felt really, really just drugged and lethargic and just not myself, not in my head. Or, sometimes it would cause tics or twitches or that kind of thing. And, I'm worried about developing tardive dyskinesia on antipsychotic medication. And so, there's a huge multitude of other side effects that can take place too as well with psychiatric medications. So that's definitely a con to taking medications. And then, beyond just the pros and the cons of using medications to manage a psychiatric illness, there's also the congruent aspect of whether or not to trust pharmaceutical companies. So, what I'm alluding to by this is things like the opioid crisis, which has just gotten out of control, and it has been out of control in the past, and it's still a huge problem to this day. And the same companies that are being sued for, billions of dollars over their hand in this opioid crisis are, some of the same companies who are producing medications for illnesses such as schizophrenia. And so there's a little bit of, skepticism that I have there over whether or not these pharmaceutical companies really have the best interest of the people who are using their product at heart. And the fact is that these pharmaceutical companies are creating medicines essentially for profit. They are private companies that are producing this medication that people need and use for their own profit. And so there's a level of, moral questioning involved over the, potential conflict of interest that exists because these companies want people to use their medications as much as possible, because the more people use their medications, the more profit they produce. And, I'm being pretty harsh on pharmaceutical companies, but the reality is that it is expensive to produce these medications. There's things like clinical trials that have to go through research and development, and all these things take time and money to do. And so I understand why there's that, business side of things too, where they need to recoup the costs, but maybe it shouldn't be privatized. Maybe it should be a public entity that only seeks to recoup the costs that they've incurred for the research and development and the clinical trials and all that kind of thing. And maybe that would alleviate some of this moral conflict that is present with pharmaceutical companies creating medications for people. And, as a social worker, I'm a bit of a socialist at heart. And so my first instinct was to say, it should be a public entity. But Rob's kind of talking to me about how there's issues with that too, in terms of, there are astronomical costs involved that the government just couldn't put forward. And so you kind of need private, donors and private investors to, play a part in terms of drug development. So maybe the answer lies more in terms of increased regulations for these drug companies to, really dig into what allowed things like the opioid crisis to take place, and how can we put in place preventative measures to avoid that happening again with other medications or with opioids again. So are we pro-med or not? And, I don't have a straightforward answer to that question, because what I hope that I conveyed through this video is that it's a really complex issue, the use of medication to treat psychiatric illnesses, for all the reasons I listed previously. And so I want it to be understood that there is definitely a spectrum involved. And, you need to be able to understand the complexity of the issue of using medication to treat psychiatric illnesses such as schizophrenia. Now, I really don't want this video to be the reason why anyone stops taking their medications. I think it's very important to let you know that I rely on medications for my daily living. As it stands right now, it is definitely a huge component of my recovery and overall wellness. And it definitely goes beyond medication as well to include other psychosocial interventions. But it is a foundational component as it stands for my wellness. Now, that said, if you do have concerns or whatnot, it's completely legitimate to bring these concerns to your doctor or your psychiatrist and to talk more about it with them. And, it might come to you guys agreeing that you want to slowly taper off medications and see how that goes. But I really want to reiterate that it needs to be in conjunction with your medical professional, your doctor or your psychiatrist. I think that, creating space to have these conversations and to question, the role of medication in your care is really important. And I think that the concept of having healthy skepticism around the issue of medication is a really important one, because I hope that you aren't just, blindly taking medication because you've been told to, and I hope that you are not just blindly against medication because of all the, adverse side effects and that kind of thing. I hope that there is some sort of balance involved where, you understand the value and the potential use of medications, but that you still have this healthy skepticism about medications, because the fact of the matter is we just don't know enough to, without a doubt, accept that medications are good for us. So, healthy skepticism is what I'm trying to get at. And I think that it's really good to have these conversations with your medical team. Okay, so thank you so much for watching this video. I hope that served to clarify kind of our stance on where we fall within the spectrum of debate around medication. And also to reiterate that I am not an actress, nor is Rob, nor are we psychologists or psychologists working for Big Pharma. I am someone who lives with schizoaffective disorder, wanting to share my experiences in the hopes of helping others who are dealing with similar circumstances. So if you like this video and want to see more from our channel, make sure to subscribe. And also, if you would like to help support the creation of future videos like this one, make sure to check out our Patreon page. Any support is so appreciated. Thank you. So thanks so much again for watching. And as always, wishing you and your loved ones good health. See you in the next video. Bye.